The last things that we're going to cut are going to be the male and female things, and sometimes they're a little bit challenging. So it'll work out, they'll either work out perfect or it'll be like a complete disaster. Your goal is to try not to cut off his little penis. We call that the Lorena Bobbitt. Some of you might remember Lorena Bobbitt. She was famous for cutting off her husband's penis, and then I think she threw it out a car window.
I think it was in a field too.
Yeah, and then I think they found it, and I think so. I think he was cheating on her or something. And so then they found it, and they reattached it or something. And then the last I heard, and I don't know if this is true or not, but I think a student told me that, is that he became a porn star.
John Bobbitt, yep.
Oh.
Is
Yeah,
he?
he did. Yeah.
There you go.
Not that I've watched it. But
I wasn't gonna ask questions.
Yeah, exactly. All right, I want to do one thing before I do the male reproductive parts, and that is, I told you that sometimes it's kind of fun to be able to detach the small intestine just so you can see how long it is. So for fun, what I'm going to do is I'm going to cut through the mesentery here. You can see all the little blood vessels that are going through. And if anybody else wants to do this, you can do it. We don't all have to do it, but it's kind of interesting. You want to be careful so you don't actually cut off your small intestine, which when I get going and I'm starting talking, I'm probably going to end up doing, but I'll do my best. So you can kind of see how the mesentery kind of gathers up the small intestine and holds it in place, and has a whole bunch of blood vessels in there that will then pool into what vessel? Hepatic portal vein, excellent, which goes where? To the liver. I love it when you guys answer my questions. My Bio 100 class yesterday, I had to, I just put my head down on the desk for a while, like, asking them all these review questions, like they have a test tomorrow. And the questions were from the lecture the week before. So, what would you guys do? You would probably at least study them a little bit, so you weren't trying to do everything the night before, which explains why they do so poorly. But anyway, nothing. I got nothing out of them. So finally, I just put my head down and was like, I give up. This is also fun because then you kind of get a different view of some of the stuff that's underneath where the small intestines are, and a little bit better view of the large intestine and the wad of colon. That's a technical name. One time when my kids were little, they were in when we were dissecting, and I just cut a hole in my glove. Oh wow. And I was talking about the wad of colon, and they found that absolutely hilarious because they were little kids, and because I had a friend named Colin.
Oh no. Poor Colin. Or just poor colon.
Yeah, exactly. So then you can kind of see on here where the small intestine joins with the large intestine. Excited? I'm trying to do it fast, but I don't want to go too fast because if I do, like I said, I'll cut the small intestine, and I don't want to do that. I want to keep the whole thing intact. The funny thing is, so we were at Culver's the other day, Friday, I guess, and who was there at the Culver's? Colin. The wad of Colin. I didn't call him that though, not to his face. I don't think he'd get it. Yeah, poor kid. Okay, so anyway, here we can see where the stomach, is, attaches to the small intestine there. So this would be like the little pig's duodenum. And then as we follow the duodenum, then we would be in the, ileum part. And then after a while, we'd be in the jejunum. But take a look at you didn't realize it while I was cutting it, but, this pig is like a foot long, and look at how long his intestines are. That's pretty impressive, don't you think? And then as you get to the very end of it over here, you can see where this part is going to dump into the cecum. So remember, the cecum is a little blind pouch. So here's the little blind pouch there. And then from that, we're going to go into the wad of colon. So normally, I mean, not normally, in humans, this would go ascending, transverse, descending, sigmoidal. But here, it's all just one big blob. And then from the colon, we're going to go into this green tube right here, which is the rectum. And then that exits at the anus there. Okay? So I'll leave this out if you are like way in the back. Ashlyn's like, that's all right, you don't have to. Yeah. All right, so so the first thing you want to do is remember how it is that you know that you have a boy versus a girl. So if I look at this guy, he is going to have a penis, but remember it's an internal penis like a dog rather than an external one like a human. So the opening for the penis is right here at the base of the umbilical cord. So here's the umbilical cord. See the little hole right there? That's called the external urethral orifice or external preputial orifice, depending on whose book you're reading. So if you go from here down, and you can even feel this with your finger, there's a tube that runs in here. And if I go like this, you can see it between my fingers. That's the penis from the inside. Okay? So, you know, if the little pig was excited and he was humping your leg, that would come out a little ways like a dog. All right. So we are going to, oh, and then if you look for the scrotum, remember these are fetuses, so they're babies, and their testicles may not have descended all the way. This one you can kind of see where it's going to be, so there's a little sac that's right here, and if I palpate right there, I feel two things that feel kind of like little hard beans, and that's where the testes are going to be. So what we're going to do is we're going to open this up so we can see the testes better from the inside. So while I'm doing that, I'm going to show you a couple of structures that as soon as I start cutting are not going to be there anymore. All right? So I'll show you, and then we'll have you move around so that you can see it. So right here is a little tube that is the vas deferens. There's a couple of blood vessels that are next to it, and they're going into a little hole in the body wall. That is the deep inguinal ring. Okay? So what I'm going to do is I'm going to take my tweezers and put them around the vas deferens. And then I'm going to take this probe and I'm going to put it at the opening to the deep inguinal ring there, going into the inguinal canal. So I want you to move around and take a look at that, okay? So move around. So again, the tweezers are in the vas deferens and the probe is the internal inguinal ring, or deep inguinal ring. Okay.
What are you doing with the tweezers?
Vas deferens. Start cutting, the opening is not going to be there anymore. All right, so what I want to do is I'm going to go kind of down the midline of the body. I want to not cut into my penis, so I'm going to be really careful and kind of feel where that is, and I'm going to go just kind of to the side of that. If I go midline in the scrotum, I'm going to have better luck finding some of the stuff that I want to find. But again, I want to be careful not to cut the penis. And so I can feel it, that tube right in here. So maybe I'll go like this so that I see where it is. You see it? Mm-hmm. Okay, so then it extends up into this tissue there as well. All right, so I'm back far enough. And then what I'm going to do is I'm just kind of going to open the scrotum again right along kind of the midline. And then just see what I can see. Okay, so I'm going to go from that deep inguinal ring and I'm going to kind of cut right down next to it. And I'm going to go into the inguinal canal. And in there, I'm going to find the combination. Okay, so right now, I might see if I can leave that on there. So right now I have the inguinal canal open. There's a little bit of tissue there, so you can kind of still see where the deep inguinal ring was. And then I can see that my vas deferens goes into kind of a covering, and the blood vessel goes along with it, and they're going to create kind of a little structure. Anybody know what structure I'm alluding to here? The spermatic cord, yeah. So then what I'm going to do is I'm going to try to gently pull on the spermatic cord and then release the testes and stuff inside of this little sac from the scrotum so that we can see what they look like. And we're going to look at this on the male cadaver as well. So you'll be able to see the superficial inguinal ring on the male cadaver. I can never really see it on the fetal pig, so we're not going to worry about it on the fetal pig. So we saw the deep one on the fetal pig. We'll see the superficial one on the human. And then the inguinal canal, we'll be able to see where it is on the human cadaver. On this guy, again, once I started pulling the spermatic cord out, the canal is basically not there anymore. This one just does not want to come out. Come out. There we go. Okay, so if I look here, then I'm going to take my tweezers and I'm going to put it around what is the spermatic cord right here. So again, if you're in a place that you can't see, go ahead and look. So what I did is I just took the whole spermatic cord and the thing with the testes out of the scrotum so that we could see it a little bit better. Okay, so again, I'm pinching the spermatic cord with my tweezers.
So on the test, like,
Remember, this sac is created by things like the peritoneum as we have the testes descend out of the body cavity. And then, so what I want to do is I want to cut a hole in that so I can see the testes and the stuff that's in there better. So this was probably part of the peritoneum that I just cut off, the outer layer of it. So this is going to be the inner layer. Again, I just want to kind of cut a hole in it so I can see what's inside, if it lets me. Problem with my 5 million-year-old scissors is they're not very sharp anymore. There we go. So I'm going to pop out the little thing that sort of feels like a bean in there. And so if I look now, what I can see is the little bean thing. This is actually quite a big one. That's the testes. And then to the side of the testes, I'm going to put the probe right now on the epididymis. So if you can't see that, move around so that you can. So again, the tweezers is squeezing the testes, and the probe is on the epididymis. Wait, I want to get a good feeling for where the penis is before I start the next part, because again, I do not want to cut this thing off. You don't have to go all the way up to, you know, where the penis connects with the external urethral sphincter, although you can if you want to. And we know that inside the penis is going to be our urethra. And I'm going to tell you that for purposes of the lab exam, we're going to sort of make some boundaries. And at some points, we're going to call it urethra, and at some points, we're going to call it penis. So anything that I'm grabbing now, and I can see now, is we're going to call penis. And then I'll show you where we'll switch over and call it urethra. But we know the urethra is going to come out of the base of the bladder. So if I think about how this bladder is in the fetal pig, it sits like this, okay? And so now I'm going to pull that back. Here's my bladder right here, right in between my umbilical arteries. So the base of the bladder is down here at the bottom, right? This is the top of it, even though it looks like it's at the bottom now. This is the bottom. So this penis needs to connect with the base of the bladder. So what I'm going to do is I'm going to kind of go from where the bladder is back towards where my penis is without cutting my penis off. The closer I get to right in the middle of the pubic symphysis, the easier this dissection is going to be. Someone will invariably go off too far to the side and end up cutting out half of your pubic bone. But if you kind of poke around a little bit there, you can feel where the cartilage for the pubic symphysis is. And on this one, it feels like it's maybe a little bit farther to the side than I expected it to be. But once I slice through that, it feels like it's right here, but it feels like it should be over a little further. Anyway, once I slice through the cartilage, then, and this will be, you know, some of you will be like, oh, that's really gross, but I can just take his little hip bones and I can go like this, and I can crack them right open. Yeah, I know. Listen, he's dead, you don't care. There we go. And then, once I, see that was not in the right spot. So once I crack him open then, I'm just gonna take my blade. Again, I wanna be sensitive to where the penis is so that I don't cut it off. But I'm gonna just kinda open it up a little bit on either side and detach my penis from the soft tissue that's underneath there. And hopefully no pieces of bone, but sometimes you get them. And then what I need to do, so right in there, I can see my urethra. So I just separated my pubic symphysis, and if you look in here, I'm gonna put the probe on where the urethra is coming out of the bladder. So here's the base of the bladder, here's the urethra. So if you can't see that, again, look. So here's the two edges of the bone, bottom of the bladder, here's my urethra going into my penis. Okay, so urethra is here. Okay, base of the bladder, here's the urethra, here's the bone, pubic. Then, what I'm gonna get to do is I need to take this where the urethra and the penis are coming together, and I need to get it out of the bone. All right, so there's a little weird piece of bone here that I need to, a little chunk I don't want in there. This is gonna make it difficult. Okay, so then, what I'm gonna do is I'm gonna come in here. Remember that bulbospongiosus muscle that's important during ejaculation? It is in this kind of area right here. And it's big, and it makes it hard to pull this thing out. So what I'm gonna do is I'm just gonna kind of take my scalpel, I'm gonna apply some pretty good pressure. I'm not really cutting, I'm just using the edge of my scalpel to kind of separate tissue a little bit. And again, I'm kind of pulling up on this, and I wanna pull away the reproductive system from the digestive system, the rectum, underneath it. Sometimes it works really nicely, and sometimes I end up poking a hole in my rectum. So I'm gonna try very hard not to annihilate the rectum there. And I think I'm gonna have luck today. Okay, so then I'm just gonna grab this kind of thing to support it a little bit. Maybe I'll switch over and use my blunt probe so I don't cut anything that I want to. Oh, success, that was a beautiful one. Okay, so I want you to look now. So here's the urethra that we were talking about before, again, the base of the bladder and the penis. And if I look down underneath it, this is where my rectum is. So here's my rectum up here, and it goes right through, and there it is. Okay, so there's a little piece of connective tissue on the top of it. That's the rectum down deep in the bone. This is the stuff that used to be in there that I just pulled out. Okay, so again, rectum goes down like this and out the anus. This is my urethra, and then the penis, and I just pulled it up. So if I take this urethra thing here and I flip it over, I can see two glands. So not this thing. I'm gonna pull that off because I don't need that. But there are two kind of big finger-shaped glands right there. Okay, you want to call them the seminal vesicles, but you are not gonna call them seminal vesicles because they're not seminal vesicles. Those are the little pig's bulbourethral glands. They are really big. And so you might ask, how come the little pig has really big bulbourethral glands and humans have small ones, teeny ones, all right? So guys, don't be offended, but here's the truth of it. In the animal kingdom, humans have relatively small penises. Okay, and so if you look at sort of, I've seen a chart that does like a whole bunch of animals rated by the size of their penis compared to their body size, and humans are like way at the end. Pigs, relatively speaking, have a long penis for their body size. So because they have to neutralize the acid in a much longer space, they gotta have a bigger bulbourethral gland. So that's why they have it. You know where I learned that? From a former student of mine who was a farmer. Cool, huh? Okay, so anyway, those are the bulbourethral. If you follow the back side of the urethra up a little further, you're gonna find two more little glands, again, on the posterior side. So they're gonna be kind of right in this area here. And those are gonna be the seminal vesicles, but you're gonna find that the seminal vesicles are significantly smaller than the bulbourethral. So there's a little piece of connective tissue over the top of them, and I'm afraid if I cut in here, I'm gonna cut into the rectum. But they're kind of between my fingers right here. There's two little glands, if you look carefully. They're kind of long and skinny. Can you see them?
No.
Yeah. Here. They separate like this.
Okay.
Yeah, it's not. So see them separate? Okay, so there they are.
That's the seminal.
Those are the seminal vesicles, all right? As far as we know, the fetal pigs do not have a prostate. So we're not gonna find a prostate on our fetal pig. Okay? All right, so on a test,